I came here just to share the experiences of trans people from my country. I also want to know the experiences from people in other countries.
Je pense que c'est très important parce que c'est une occasion d'apprendre les uns des autres, premièrement. Deuxièmement, je pense que ça peut permettre de créer un réseau pour les personnes trans pour faire avancer nos droits.
It's kind of tough, especially with strangers, because then it's kind of the confusion, like the kind of feeling of confusion by them looking at me could very easily be violent, whether it's violent physically or just the fear, because I think every trans person walks around being scared, whether they quote unquote pass or not. So that's the only bit that I feel like other people who don't know me find it difficult.
Le défi pour les personnes transgenres en Côte d'Ivoire, il faut dire que les populations sont en marge de la société parce que chez nous, quand une personne ne respecte pas le code social, c'est-à-dire qu'un homme doit s'habiller en homme ou une femme doit s'habiller en femme, et qu'une personne essaie d'être contre les normes de la société, automatiquement, tout y suit. Donc, le rejet de la famille, l'insertion sociale qui est bafouée, on ne peut pas travailler, on se retrouve à la rue.
I don't even know which doctor I could go to because you never know, you might be kicked out. Even if I wished to go there, I don't know how the treatment would be and how the response would be.
J'ai déjà approché les docteurs et les professionnels de santé pour les expliquer la thématique transsexuelle, mais eux, ils pensent que c'est une pathologie. Donc, ils pensent qu'ils doivent être soignés pour quitter la transsexualité.
Our advocacy work now, it has gone, we have 10 districts in Lesotho. It has gone to 5 districts. Within these 5 districts, there's assurance that everyone who goes there access the service without being humiliated or without being boxed somehow or stigmatized here.
The health services in Namibia are general, especially if you're working for a very good company and there's medical aid involved. You know, you can go to any doctor without any discrimination and stuff. But then when it comes to public health, it's quite difficult, you know, because when you go to a hospital, for instance, you are being ridiculed, you know, by nurses and medical staff like, yeah, you know, the reason why you are sick right now, it's because of those things that you do or because of who you are, you know, and all these funny comments being thrown all around, which makes a lot of trans people not want to go seek medical attention and help because not everybody has a nice job, not everybody has medical aid, you know.
I mean, if you want to go through any gender reaffirmation procedures, then you must have the money. Not just because of your gender identity, but also because the healthcare system in Kenya really doesn't work for people who don't have money. So the public hospitals are cheap, but then they don't have services. So just to pull an example, we have one cancer screening machine, a chemo machine, and it broke down at the main referral hospital. So already that system is broken. And for anything, including trans-specific care, you need money to see a private practitioner or to go to a private hospital because that's where you might find staff. A lot of us speak from a position of privilege that I could afford to pay a consultation fee that probably someone else can't afford.
Some of the things we don't get access to from my country, though we are supposed to be getting, you find that it's only in documents but not applied. The necessary needs for trans people are not taken into consideration. Hormonal therapy, surgery. I personally think that doctors have haven't been sensitized or educated on transgender issues.
Ce n'est pas possible d'avoir accès aux hormones au Burundi. D'abord, tu ne peux pas trouver un docteur qui peut te faire la prescription. Deux, même si tu trouves le docteur qui te fait la prescription, tu ne peux pas trouver ça dans les pharmacies.
We've already done a lot of work in workshopping with medical practitioners, and because it's also not very friendly to do that kind of work, it's just finding individual friendly people and going through it with them, and then they could, whether that's legal or not is another question, but there are doctors who are willing to help trans communities. So majorly we almost all see the same people, so the same psychiatrist, the same kind of whichever other doctor we need to see. So for example, I get a yearly prescription from my doctor for hormonal therapy, and one of the ways is going to the same pharmacist so that they already know what you need and no questions. So that's easy.
I remember I tried seeking for hormonal therapy and services, and then I was told that some of the things that I may need are not allowed to enter the country.
Je dirais non parce que les endocrinologues qui travaillent à Abidjan travaillent spécifiquement avec les femmes. Ils ne veulent pas travailler avec les trans.
In our constitution, it says after you have transitioned, you have the right to go to Home Affairs, Ministry of Home Affairs, to change your documentation and your gender marker. But then if resources like hormones and transitioning are not available, how are you supposed to access those, those rights that are in the constitution?
Ce qui m'a inspiré d'être un activiste, c'est parce que d'abord, moi, j'ai eu la chance d'être accepté au niveau de ma famille. Et je me suis rendu compte qu'il y a d'autres amis et d'autres personnes de ma communauté qui n'ont pas eu cette chance. Donc, ce qui m'a poussé à vouloir les aider, c'est ce qui a fait que je suis devenu activiste.
There is some kind of understanding from part of my family, though not all of them, and other people around me do understand, though some don't really understand. They still refer to me as gay.
I don't think I'll ever come out because I'm not coming out to do. I'm just myself, so my family just knows me as myself. And I think it would be very confusing if I started telling them about being trans. They'll be like, what are you talking about? And why are you telling us that now? I wouldn't say that they're supportive or not. We just never have that conversation. We've never had the need to talk about it.
I went to Cape Town for the first Trans-African conference that happened, that was organized by Gender Dynamix. So my mom always thought that I'm this effeminate gay boy, but then during that conference I actually stole one of her dresses that I always thought was amazing, and I was like, oh no, I'm taking her, I'm gonna be wearing her. And then I bought matching heels and got the the dookie thing for the hair and pipe, as we call it in my language. And then I came to South Africa, and then I was like in that dress, and I was like working it, and it was amazing to feel comfortable in myself, to be wearing comfortable clothes that I'm happy in. And then when I went back, my mom was like, where is my dress? You are the only one that has been missing. My dress is missing. And then I was like, no, here's your dress. I took it to. And she was like, what? And then I came back with a portrait that I was wearing with a dress, and she was like, oh my God, then you should start wearing dresses. You are my daughter. I know that's what you've been saying all this time, but I never actually thought that you'd go to the extent of, But then if that's what you want and that's what you feel like, go ahead, And even after that, when I would go and buy, clothes, she'd be like, so where's the dress? Where's the bra? What's happening here? And then I would be like explaining, not everybody in Namibia is like you, mother.
There is a lot of sensitization going on to the health sector being done by the organizations, especially Rock of Hope, through the Ministry of Health on the Swaziland National AIDS Program, working hand in hand with the key populations. They are able to facilitate and sensitize health practitioners on key populations, or rather on transgender issues.
We have started working with the civil society organizations, and also making sure that there is visibility of our movement within the national programming. It's just for us to push implementation of what has been planned.
Je me sens optimiste parce que déjà il y a la communauté trans qui commence à émerger, qui commence à se faire voir et à s'accepter comme telle.